Hi everyone, I'm John from HTN and welcome to this webinar today where we share the findings from our recent audience research where we explored what's really frustrating frontline and IT staff about digital systems today. So our research involved a survey to the HTN audience, and if you're on the call and participated in that, we'd like to thank you for taking the time for doing so. And also the HTN team did a series of interviews, and that added to the data and added depth to our research that we plan to share with you today. So over the course of the session, we will share our findings, and that will cover the biggest friction points staff face daily, where manual workarounds are still happening and why. We'll talk about the priority areas for digital systems that users say need urgent attention. And then we'll also go on to probably the most important thing, actually, is what can be done in the short term. So what are some of those approaches to address these challenges and how can we do that more quickly, I guess. As well, I'm also keen to hear from you in the audience. So we've got a couple of polls today, so I appreciate your input into those. So keen to hear your views personally or whatever is happening in your organization. Please answer some of the sliders that we have today. And as well, if you have anything that you'd like to share, please do so in the chat. If there are any questions that you would like to ask, do so in the chat as well. But let's first start with some wider introductions. So we did the research report with Aire Innovate, and we have Fiona and Ian from Aire Innovate joining us on the call today to discuss and share some of our findings. So let's start with some wider introductions just so we can meet our panel. So Fiona, welcome to the webinar. Could I ask you for a wider introduction, please?
Yeah, of course. Good morning, everybody. It's lovely to be here today. My name is Fiona Costello, and I'm a member of the team at Aire Innovate. Aire Innovate is a low-code technology platform, which sounds a little bit technical, but what it actually means is that it focuses on empowering you and your teams to be able to develop pathways and workflows that digitize and enable you to work smarter, not harder. Thank you so much. I'm really looking forward to the discussion today. I think the report was really interesting.
Me too. Thank you, Fiona. And Ian, over to you.
Yeah, hiya, I'm Ian Dove. I'm Director of Product Strategy at Innovate, but previously I've spent 14 years in the NHS, either in community, large integrated trust, and then latterly running a digital health company that was owned by the NHS.
Fantastic. Thank you, Ian. Right, let's start. And let's start with our first question in the survey where we asked, where are the biggest pain points? So I'm keen to hear from you in the audience. So we have set up a Slido. So if you could go to slido.com and type in the code 1484272. And then keen to hear your views. Where do you think the biggest pain points are? And if you could type into Slido and that'll come up and share on our screen that Jenny's presenting. You can also use your phone and scan the QR code and then use it on a device. So keen to hear from you in the audience first. What are your biggest pain points and what's happening in your organization? So we'll give you a minute or so to type some of those in, and then we'll discuss and share what we found in our report, and we'll ask Fiona and Ian to share some of their views too. So looks like, right, the technology's working. A couple of people are typing some answers in, so that's great for you. We'll just give you slightly bit longer. Okay, so the first answer's on multiple systems, bugged releases, too many logins, interoperability, building costs to the business, concerns around building costs to the business. The systems themselves are the biggest pain point. So Fiona, what's your views on some of these answers that are coming in?
Yeah, I mean, I don't think they're surprising. I think, there's a reason why we as a sector spend a lot of time talking about interoperability in particular and how information crosses through systems and data silos, and particularly in a world of AI and an enthusiasm for AI, but not even having the foundations in place. So it doesn't surprise me that these are some of the comments. I'm just reading actually as they continue to come in. And I think again, the sort of the one that just I've seen is not enough training and support time. I think Ian and I were reflecting in a conversation offline about how there's been a tendency, certainly in the time that I've worked in healthcare, which has been sort of the last 20 years or so, that it's always felt top down rather than driven by people on the ground. And I think that's reflected in their day-to-day experiences of using technology, which should be making their lives easier, but actually in some cases makes it harder.
Thank you, Fiona. And Ian, what's your perspective?
Yeah, I think as Fiona said, we discussed it this morning. From my experience inside the trust, there's a kind of disconnect between the vastness of an EPR and the individualization of clinics and the provision of clinics, and the workflows have variances, and then clinical practice changes. It's really difficult to get a monolith to change, and that causes some frustration, and a lot of this is about making sure that your team are on board and they're absolutely behind the installation of an EPR, and it's about how we can continuously move the dial so that those people remain engaged and supportive.
Thank you, Ian. What's interesting here that the answers are quite varied.
Yeah.
There's not really like a theme, because it's from training, leadership, systems, user interface. There's quite a lot. So if we have a look at the report itself, what came out in the report from the HTN audience? Fiona, what came out in that?
Yeah, I mean, I think the top themes were that the systems weren't necessarily being built around user needs. Obviously, the very nature of procurements is they become very binary, and that unfortunately does become black or white when you're bidding against these sorts of tenders. But what it forgets, I guess, is the grey, and it's the grey that impacts and influences how people work day to day. And I think that's why you then have some of these challenges with engagement. Overcomplication of processes, or maybe a lack of understanding of processes for day to day, how the workflow and how the processes work. Poor integration, poor interoperability. Again, some of the more technical things around downtime, bugs. I saw someone was saying about bugs, and obviously all of these like little things, these day-to-day experiential things, erode confidence, and that then compounds sort of a mistrust of these systems, which then again, I think leads to some of the issues that I know that we'll come on to, and poor training and support, because again, as I said, it's top down, and so it might be that this particular system is rolled out, but it's like, how do you actually equip clinicians and professionals to work with that system that meets them where they are in terms of those workflows and pathways?
Great points. Thanks, Fiona. Ian, is there anything that you would like to add?
No, I think in terms of the training, which has come up a lot on the slide, I think I spoke to one of my ex-colleagues earlier on this week, and she was disappointed that the organisation had adopted the e-learning package. She didn't feel as though her and her team got what they needed from e-learning, and I think that's definitely a lesson around when you're framing your procurement, is to understand there's different needs of those clinicians on the front line around their training requirements. Some may prefer face-to-face engagement, some might want to do it e-learning, and it's about understanding that you've procured the best route to deliver the optimization from the organisation.
Great points. Thanks, Ian. It looks like Slido's summarised the answers for me, which is great. So 3 people said training, and but the majority said systems themselves are the biggest pain points. So that's interesting. Okay, so we'll move on to the next question. Jenny, could we go to the next slide, please? So again, another question for you in the audience. Keen to hear your views on this one. So it's where do clinicians or admin staff spend the most time manually entering or transferring data between systems? So this was a question we asked in our survey, so we've got some answers to share. Also keen to hear your views in the audience as well. So we'll give you a bit of time to do that. But while we're waiting, actually, Ian, what were some of the responses that we got in the survey, in the report that we had?
Yeah, so we had a variant of different responses around the patient information, the manual data entry, how when you're receiving information from other trusts or other providers, how that was a really laborious task and how that had to be all manual. The electronic discharge records, we know that there's changes into what needs to be included. Blood transfusion is a new one that needs to be included on a discharge letter. Those simply don't exist currently in the EPR, so there's a lot of manual workarounds, and the clinicians who are really under pressure at the moment are really feeling the pain around some of these additional tasks that need to be done manually. So there's also the right back function and results reporting is really complex within the context of that EPR.
Thanks, Ian. And Fiona, what's your views on some of the responses we've received so far from the audience?
Yeah, I mean, again, it's very consistent with the report in terms of sort of manual entry of patient information, care, and some of this information being able to transcend organizational boundaries, and then what that means for again the delivery of the actual pathway or the delivery of the workflow, and these friction points that again not only erode confidence but in all likelihood impact patient care as well around this transfer of information that's actually really important. So, you know, sort of post-acute discharge, for example, or a referral into community. It's mad in 2026 that we're still having to talk about how, and like, you know, some of this information is manually inputted. We should be in a position where some of that is just automatically overcome, and we're not. And you know, that is very consistent with the findings in the report as well.
Fantastic. Thank you, Fiona. And we'll get onto this shortly in the webinar in terms of like how can we approach and tackle some of these challenges, and we'll particularly talk about the referral, discharge, transfer of care process. Is there anything else that came up, Ian, in the report, or anything that you'd like to reflect on what's on screen?
There was one interesting point, and I hadn't really considered this until I spoke to a clinical safety officer in one of the local trusts to my area. And it was the use of autofill and copy and paste into the clinical records for individual patients to save time, because those clinicians are really stretched on the front line. And what she was reporting was the degradation of the personalization of the clinical record, which was a really interesting concept. And she felt as though this was due to the multiple steps that were added into the process. It was taking more time to update that record, and therefore autofill and cut and paste were becoming more and more popular, and that isn't, I guess, the intention of the clinical record.
Great points. Thanks, Ian. Fiona, is there anything else that you would like to add, or anything that was in the report that we've not covered here?
No, I don't think so at this point. I thought, you know, just reflecting on Ian's point, I think that the autofill is a really interesting kind of potential issue, because I think it's, you know, in that bid for efficiency and speed, to what extent are we losing the richness of the data? And again, how are the workflows actually supporting the intention of the pathway? So by what I mean by that is, you know, what are we missing? Like, are we missing these more social determinants, for example, that are influencing someone's care, or their sort of ability to maintain compliance with what's being suggested to them to improve their health and well-being? I think these are really interesting points. And again, I think sometimes we lose that context, and there is a balance between sort of the clinical delivery and the importance of that context versus the efficiency. And so I think it's a really interesting, multifaceted issue, I think, just reflecting on Ian's point. But I think the main thing, and I think this is coming up, is that, you know, things like mistyping language, errors, you know, the manual entry of patient information is obviously contributing to that. And so I think some of this is actually really basic.
Mm-hmm. Great points. Thanks, Fiona. Right. Let's move on to our next question. So we've got another question, another Slido for you in the audience as well. So this time, what extent does it change when thinking about workflows and workflows across multiple agencies, including the third sector? So this is our third Slido of 4 Slidos today. So again, keen to hear your answers to this. So on this question, Ian, what were some of the themes that came back from our research report?
I think in terms of the research, there was a lot of copy and paste in. There was a lot of manual updates. There was very little interconnectivity between different agencies that are providing elements of care. I think going back to one of my previous projects, I was digital lead for the Healthy New Towns project, and we were working with Age UK and various different providers to deliver a project around social isolation and undernutrition to try and bring people back to a social group where they would have hot meals and improve their undernutrition, but there was no connectivity between the systems, so there was inability so that the people in the hospital could get a rich view of that individual's patient's wider care. And I think it's really important, and flowing through to the report is that integration is non-existent at the moment, and I think we need to focus on how we can deliver that richness within the clinical record.
Definitely. And Fiona, what's your views from what we have on screen from our audience and from the report as well?
I'm just reading them as they're coming through. Yeah, I mean, I think that, when we're sort of talking about information crossing through multiple agencies, we know that obviously adds a greater complexity. And I think that, people on that are responding to the survey are quite rightly concerned by some of the workforce changes that are happening at the moment, and that is creating an additional burden. And if anything, compounding some of those issues. I can fully empathise with that. I can well imagine. I think what was interesting about the report was some of the governance framework itself and the friction that was creating around the ability to share information across different providers. And I know from my experience, so in addition to my work with Aire Innovate, I also do some other things. And one of the things we're talking about is how do we demonstrate the value of what we do within the primary care, and then you're talking about interoperability, integration, all of these different things. And I think depending on the maturity of the organization, some of these asks are bigger. And so I think having a framework that is inherently focuses on interoperability and really starts to look at those barriers and starts to give GPs the confidence, for example, that definitely came up in the report, that primary care there's a level of nervousness around kind of enabling that data sharing because of data controller agreements and so on. And I think that's really important, and we can't move away from that in terms of the complexity that it adds and that cultural resistance that it adds for quite, for legitimate reasons.
Yeah, thanks, Fiona. And Ian, we've had quite a few comments come in now. Is there any other themes that have come up?
No, I think that the big one seems to be around data sharing and information governance, and that potentially is a resource constraint. I know there's some really great IG guys out there who see their service as an enabler, but I think it is certainly a barrier to adoption, and it's an easy way to block the adoption of innovation in practice. And I think potentially, that's an area of focus that we really need to sit around the table with the information governance teams to see the path through some of these blockers.
Fantastic, thank you. Right, so let's move on to our final Slido, our final question for you in the audience, and this is around IT capacity. So to what extent does IT capacity or business case processes stifle innovation or changes to workflow? So we've spoken about some of the challenges and pain points with processes and different workflows, but are there things that stifle those changes, and does that itself lead to manual workarounds? So keen to hear your views in the audience on this question as well, and what's happening in your organisation around that. Fiona, what were some of the themes that came up in the research report?
There was an overwhelming consensus on lack of capacity, long lists of requested changes that have to be triaged, and I think that in my work with Aire Innovate, I spend time overseas as well, and this is a really common problem that IT teams within healthcare organizations are sort of seeing 2-year, 3-year IT backlogs. And obviously, when you're a clinician and you've got a patient in front of you there and then, that's a really big issue if it's then directly impacting or influencing the way you're delivering care. But particularly when there's these like policy ambitions from analog to digital, I think again it feels like there's that disconnect between the language and then the day-to-day experience, and I think that's then compounded by some of these capacity issues. And I think, notwithstanding the sort of the competitive tensions between the private sector and the public sector in terms of the skills that are involved in some of these areas, I think that some of the leadership changes and some of the changes across the NHS as a whole is only going to compound it. So it doesn't surprise me in the least that capacity and the ability for these teams to be able to respond to some of these challenges was a really big theme of those within the report. And I think is again sort of coming up in the Slido responses, as well as kind of how you're tackling some of these legacy systems as well, which I'm sure Ian can comment on.
Yeah, I mean, some of the Slidos are exactly what I personally experienced in the NHS, and some of the CIO colleagues that sat alongside me were only funded to keep the lights on, so it was business as usual rather than innovating. So I feel the pain of some of the audience in terms of some of their comments. I think it's a really difficult situation at the
I think you might have just paused, Ian. Yeah, Fiona, are you still with me?
Yes, I am. I'm
So
still
it
in,
might
yeah.
just be Ian, and it's not me.
I
So
had that
that's
slight panic that it might be my end, and then I saw
yeah,
you
me
moving.
too. I had that, and I was holding fingers crossed that right. Okay, that's fine. Well, hopefully Ian can join in a second. We have had a question come into the chat, Fiona. So if I could ask that now, it seems like a good point. So Stefan's asked about digital champions at trusts. Is it a good idea, and perhaps could they help with some of the pain points that we've spoken about so far?
Yeah, I mean, yes, I think so. I think creating a culture whereby digital is seen as a solution rather than a kind of a blocker, and thinking about how do you create that kind of that confidence across your teams, across your colleagues, across different services and specialties, I personally think is really good, because I think some of this is about culture for reasons we'll come on to. And I think it's about, if we know that there are blockers in capacity within these IT teams, how do you empower those that are immediately seeing the issues with a particular form or a particular process or a particular pathway, and how do you give them the skills and the confidence to be able to, and the guardrails to be able to make those changes without then losing confidence in their IT team or the system itself, because purely because of capacity. And obviously it's changing all the time. So, when things are quite fixed, but then a pathway is evolving, whether it be for new evidence or whether it be because of patient feedback or clinician feedback, it is important to maintain that agility. And I think creating that culture with digital champions could be a really positive step forward, and starting to create a bit of a movement across. That all sounds a bit, grandiose and a bit kind of a movement, but hopefully it's consistent with the ideas of digital champions.
Great points. Yeah, thank you for that, Fiona. And we've had some interesting comments come from the audience as well, which Slido's suggesting that there's been a mix. So from processes to capacity to change and change management, like we've spoken about, the systems themselves and infrastructure. So lots of different pain points there. So yeah, that's interesting. Is there anything that you'd like to add, Fiona, before we move on?
I think, I think with the key to all of this, and I suppose an overwhelming message, is to sort of to meet people where they are, to kind of understand what the issues in the pathway, because the issues that are today, come to my earlier point, the issues that are today may not be the issues tomorrow, or may not be the issues in a month from now or 6 months. So if you're then looking at IT backlogs, it's already outdated. So I think we have to kind of create this sort of fail fast, learn faster but also give people the safe space to be able to do that. It doesn't have to be a big bang fix it, which we'll come on to, I'm sure, in the second half of the webinar.
Fantastic. Thank you, Fiona. So that is it for our Slidos, but in our research report, we had a couple of questions and I'd like to cover those, and then we'll go on to what are some of the approaches to fix some of these challenges quickly, and we'll talk about those. So in the report, the next question was, do frontline staff have access to tools that allow them to build or customize digital workflows without the need of a developer? So can frontline do it themselves? So what's your view on that, Fiona, and what came up in the research report?
So my view on it, as someone, inherently, I like to be able to fix something there and then. It annoys me when I can't. So, my view on it is that absolutely we should be providing people with the ability to be able to do their job safely, effectively, at speed, and in a way that doesn't create friction. And I suspect that because some of the challenges that have been highlighted and identified around capacity, that the way to do that is to provide these tools. But in terms of what the report said, it said that only 9.5% of respondents indicated they had access to these capabilities, and that the vast majority of people were putting in these requests to teams, which again just sort of erodes confidence, because obviously if you're waiting in an IT backlog, of course you're then reverting to shadow IT. So what I mean by that is you might create a form that you then print out, or you might have an Excel spreadsheet, because that is still better than waiting months and months to have that one thing that you need fixed done. And so it doesn't surprise me. I thought what was really interesting in the report was that the idea that healthcare professionals could be the architect of their own solutions was this sort of nirvana concept, and that that they were miles away from it because of governance and patient safety. What I thought was interesting was that there was an inherent contradiction, I guess, because at the same time you're seeing people kind of doing that anyways. Whether it be they're reverting back to paper, or whether it be because they're doing it on an Excel spreadsheet, shadow IT, as I mentioned. I think we have to create a framework that enables and empowers people to do their jobs and to do it in the most efficient and productive way as possible. And I think that is about equipping them with the skills, the confidence, and a safe space to do it with appropriate guardrails. So it's not to dismiss the concerns around patient safety or safety as a whole or governance as a whole, but thinking how do we create, again, that culture? How could a digital champion, for example, create a safe space to workshop some of these things at pace?
Great points. Thank you for that. The next question in our research report was around forms and patient communications. So we asked what percentage of forms or patient communications are still handled via paper or email. And I guess this could be a question for the audience too. Like, roughly what percentage in your organization is still paper-based and on email? So I'm keen to hear from you in the audience, but from our research report, what were the findings, Fiona?
Well, nearly all of the respondents highlighted, to a greater or lesser degree, that there were still processes and information capture that was still paper based. And that what was interesting was the variability within trusts themselves. So whilst, for example, you might have a maternity unit that had 90% of these sort of information capture digitized, for example, there were other parts that didn't have any. And there's various different, sort of 0 to 20%. I'm trying to find them, but I think it's interesting, isn't it? There's that inconsistency within trusts, within services, within directorates. It's not even like there's particular silos of care. So it's not like primary care has got it completely sorted versus community care versus secondary care. It's actually there's that some of that those gaps within the organizations, within the services. So it, again, I think digital champions would be really powerful in that context, because it's like, okay, well, if maternity have done this, what was their journey? What were their learning points? What would they do differently? What were the successes? Like, I think that would be a really powerful way of sharing that learning and kind of the quick wins. I do think there's a tendency to think that it all has to be done at once. And therefore, because it all has to be done at once and there has to be these big, massive transformation projects, the danger is you just wait and then nothing happens, which again compounds some of that cultural resistance that we've talked a little bit about. Yeah, I mean, it would be interesting to hear from the audience their perspectives on that point.
Yes, definitely. I agree. So keen to hear from you in the audience on that one too. We have had a question come in as well, which is a timely question for where we are really right now. How do we continue to motivate digital clinical leads whose roles were reduced due to funding cuts? What's your view on that, Fiona? It's a tricky question.
Well, it is a tricky question. I think, firstly, I think empathy goes a really long way. I think understanding that we are in a really difficult period, and we have been for a number of years now, in truth. And I think that when you've got an ever long list of things that need to be done and your resources being constrained, I think empathy and a recognition of that is really important. And then I think it's about kind of looking at some of the tools that we're going to talk about that we do at Aire Innovate. So it's like, what could different organisations offer to the NHS to support them in a way that's safe and effective and allows them to extend their reach? And I think that's why we use digital in the first place, isn't it? It's not that we want to use digital to replace the human at the heart of it. It's to extend their reach, to extend their capacity, to extend their capabilities. And I think it's just as true for digital teams as it is for the use of patient-facing apps, for example, to extend clinical pathways into the home.
Fantastic. Thank you, Fiona. And welcome back, Ian. Glad you're back. Fiona's done a fantastic job.
Excellent.
Solo.
Excellent. She's a star.
Yeah, absolutely. We're on to our final question in the research report. So the last question we asked to our audience was if you could digitize or transform one task tomorrow without needing IT resources or a developer, what would that be? So really interesting question. Ian, what came up in the research report on that one? What were some of the findings?
So I think there's various different findings, and I think a lot of them were biased around the risk of allowing frontline staff to develop their own workflows or make their own changes, and I think that's a really important concern. But I think if we look back at the question around capacity, we're really struggling for capacity within the IT teams. So in some ways, we need to understand how we can federate that resource out to the clinical teams, but in a safe way. So they're the guys that are feeling the pain. This is what we talk about in the organisation, about the frontline clinicians who are feeling the pain, but also the IT guys are feeling the pain because of the lack of resource and investment in those areas and the mountain and the wall of noise that are in front of them. So how can we find a path through this with safe governance and control and enabling people to make changes within their systems, but in a controlled way, where we have the governance that are wrapped around, that we can have the testing that is automated so that we can understand what those changes have an effect and do it in a safe environment. So maybe a sandbox, so we can arm the clinicians or the frontline staff like business analysts with tools that can enable them to iterate really fast to solve some of those pain points that are happening on a daily basis. That will give us such a boost to morale if that people can see that problems are solved fast within the context of that clinical delivery. And I think that's the nirvana that we're trying to find. And I think we've just started within Aire Innovate to deliver Aire Intelligence, which is the AI-driven development of things like forms. So you can upload a PDF and it'll create a form for you. We can upload a video document and it can create a workflow for you. And that's the kind of tools that we need to iterate fast, but it needs to be supported with really good sound governance in the background.
Great, thank you, Ian. And Fiona, what's your perspective from what people responded? When they were asked about one thing that they could transform, what were some of those themes, or what's your perspective on how we can tackle those?
Well, I think what was striking about the report, and certainly in Mike's observations at the back of the report, was the manual rekeying. So, when you're having to spend time taking information from forms and then having to manually input that into another. I just can imagine that when you're a time-pressed clinician or a time-pressed member of the team with a backlog or 100 of these to do, that it would be an incredibly difficult and irritating thing to have to do. So I think, from in the extent that digital can help with that, we talk a lot about AI, and we talk a lot about AI in terms of being able to be sort of this nirvana, almost an ambient AI. But I think its ability to help with things like that, the ability to take unstructured data, for example, and be able to input it in a way that makes sense and has that context, I think, from a technology perspective, I think we're quite fortunate to live in a time where some of these advancements are coming on board. But I do, at the same time, there's that like inherent contradiction, isn't there? Because on the one hand, we're talking about manual rekeying, and on the other hand, I've got AI in the same sentence, which just seems a little bit bizarre. But I think it's true. It's like we've got to tackle some of these really low-hanging fruit that just shouldn't be an issue in 2026, that really does start to eat away at people. Because, I think one of the things that may not get talked about is that when we talk about sort of clinician burnout, when we talk about burnout in the health service as a whole, some of this is directly contributing, just the lack of ease, I suppose, and the friction that it creates. And I think where technology can contribute to that, and where that's actually the solution, rather than big multi-million-pound solutions, that actually it's that one particular thing that eats into hours of your day, that would build the most confidence, and and it will create a snowball effect, I suspect, that if you can see technology resolving some of those challenges, and with that in mind, I think that it starts with a particular process or a particular workflow and the point of friction. It's not trying to solve everything all at once, but just trying to think, how do we just systematically tackle some of these issues, because actually it really is impeding the pathway and the experience.
Absolutely. Thank you for that. And that was our final question in the report, actually. So we have published a PDF of all these findings, and we will email that to everybody on the call after this call today. We'll send you that by email so you can take time to reflect. So there's been a lot of challenges discussed, like what Fiona's just mentioned, around like rekeying information, copy and paste came up, some real small issues that could be fixed quickly, and I'm sure people would be delighted for those small changes to be made. So I guess that's leading into the next question. So what can be done in the short term, and what are some of the approaches to tackle these challenges? So Ian, you've briefly spoken about your platform, but what would you advise to the audience to do in the short term, and what can be done in the short term?
So from my point of view, there's a couple of things that can be done. For those that are implemented in the EPR, there's a great report that's just come out from the Health Services Safety Investigation body that's reviewed all the EPRs, which I think is a good resource for people to, as they're developing the strategy. But in terms of what we've been doing at Aire Innovate is really thinking about what's needed for those people who are already into an EPR adoption, and that's not layering another EPR on top. And we've come up with the concept of Aire blocks being small component parts that can fit into the gaps, that allows people to add the functionality like integration, workflow, forms, multiple clinician forms, testing. So we've developed a platform that will enable them to tackle some of those small edge cases really quickly. And with the adoption of AI in the development space, means we can do things really fast. So what I would do is start with the workflows. There's 1,000,001 edge cases. Each clinician, each specialty, each clinical area, each specialty may have their own workflows, and that will be different in each organisation, as the commissioning structures and services are commissioned very differently, and the provisions of the community services. So I'd start with the workflows, understand the workflows, and reframe that procurement, so that we really understand that all of those edge cases that exist before we step into those procurements.
Fantastic, thank you, Ian. And Fiona, in the research report, the referral process came up quite a lot, and the discharge process and those workflows. What can be done in the short term to improve some of those processes? What's your view and on that one?
I mean, I think in broad terms, it's quite difficult to kind of answer that, because I think it'll be dependent on the different circumstances that might be within different pathways. But I think the way to look at it is to map it out, to understand, if we know that the issues are across those boundaries, across organizations, don't focus on a workflow internally, but think about the overall pathway. Think about where those points of friction exist. So if you know that you're spending 20 minutes manually inputting that referral that came through because it's a PDF, and now you need to spend 20 minutes, like, that's the place to start, because then immediately you're getting productivity gains, and you're having a more efficient process. So I think, to Ian's point, really think about workflows, really think about pathways, and then think about the worst bits from a data perspective. So where is that point of friction, and what is the most sort of elegant solution to it? So is it some kind of interoperability? So like AirGlue, for example, where you can take information and pass it through to another system, or is it more actually that the data itself isn't right, and it's therefore the issue is being able to capture the right information, and that will vary from pathway to pathway. And I wouldn't want to speak on behalf of colleagues to say what is the one thing, because I'm sure they all have different experiences. But I think in general terms, those are some really good places to focus on.
Fantastic. Thank you, Fiona. And one part of the survey spoken about giving people the tools to fix things themselves. So, Ian, we had 9.5% of the responses say that they had the ability to do that. So significantly a lot don't. What are the barriers in place that are why that people are not able to do that, and why is that so high?
I think some of those tools don't have the flexibility. An API is there to make sure that the data is safe. The organization has a solid platform to enable you to deliver that care. But we know that care is complex and has variety within that, and there's a set of controls within the organization, and rightly so, that changes can't be made rapidly. So the control is contained within the IT teams, and I think this is part of the crux of the issue, John, that I think we need to have a look at, is how we, as I said previously, federate that ability to make changes within a safe, controlled environment. And I think, coming from a transformation background, which I do from a trust, there's a whole wealth of service transformation resources within that trust that understand workflows, that understand process maps, that can identify a problem and fix it with a neat new solution. And I think it's how we can flip that. And a tool like Airflow, which is our workflow tool, enables you to build the digital tool out in real time in terms of that process. So we're talking about delivering, once you commit to those resources and give the training, being able to deliver a digital tool within a couple of weeks rather than the years that it's taken today.
It's an interesting concept, this, because with paper forms, I guess they did have the tool to do it themselves, because and actually going to digital has changed that. So there shouldn't be that much fear, but why it's so high is interesting. Fiona, what's your perspective on giving people the tools to do this?
Yeah, I mean, I think it comes back to creating a culture, and giving people the tools to solve the problems that are impacting their day-to-day, and therefore their ability to provide effective care, or their ability to be productive or be efficient. But I think, and I think it's been a symptomatic of digital as a whole, which is that there are genuine worries, there are genuine concerns about the governance and about ensuring you continue to be safe and effective. And I think that's where providing that sort of that almost like that sandbox concept, and thinking about sort of these identifying roles like digital champions to sort of work with people to create a space where they can say, do you know what, in my particular pathway, there's this one particular thing, and this is the thing that's causing the issue, and then you workshop it. And I'm not naive. I know that people, their argument will be, I literally don't have time for that. But at the same time, if you know that your IT teams don't have time for it, and you might be waiting 2 years, then it's about maybe thinking about kind of how do you create that culture, and how do you again extend the reach of your digital clinical leads or your digital champions or your IT teams, but doing it in a way that kind of makes people feel safe and that they're able to do it. But also I think it's this sort of it becomes a self-fulfilling prophecy, because when you see the speed and the ease at which some of this is done, you know, what we've done with Aire Intelligence is we are now able to take a paper form and we're able to put it into AI and it will automatically populate the form for you. So we're not even talking about creating the form anymore. It will do it. And then it's about refining it, tweaking it. You can then edit because you don't capture that particular bit of information. Like, and we're talking like seconds. Like it's those sorts of things that I think will build this confidence and this skills, because without a doubt there is genuinely an inherent risk with relying on paper for all sorts of business continuity reasons. But I think the fact that we still tolerate it, the fact that we still are able to kind of, that it's still the default, and that we're able to sort of think about that, some of that shadow IT in terms of like Excel spreadsheets and whatnot. I think that, you know, we have to give people the ability to kind of look at those little things that will incrementally improve their experience day to day.
Yeah.
Great points. Thanks, Fiona. Ian, is there anything else that you would like to add before we move on?
No, I was just going to move on from Fiona's point that the backbone of the pain points are felt within the nursing cohort. They're the guys that do the high volume, but they're also the most innovative, and they will find ways around to making that process easier. At the consequence of not having the data in the right place, and what we want to do is be able to support that cohort to innovate and make sure that that record is as rich as it can be.
Fantastic, thank you. And just before we go to some audience questions, is there anything else from you, Fiona, that you'd like to add?
No, I don't think so. I think that, you know, I think in the same way that we've talked about what can you do in your own service or your own pathway, I think it's also about kind of, again, that culture then becomes cross organization. So the ideas of these sandboxes, for example, like how do you create it so that your different organizations can input as well, where you've got multidisciplinary teams, or whether you've got, you know, different parts of the pathway being delivered by different organizations, creating that space to kind of workshop these together. Because I think a lot of this is about meeting people where they are and not having that top-down approach, but rather, no, this is actually the day-to-day reality of what actually happens in the pathway, not this idealized version that looks really great in black and white, but actually for a whole host of reasons doesn't work. And so it is important to create that kind of culture of being able to talk to each other, collaborate, and see it in real time. And that's what we aim to do with Aire Blocks. We aim to create an environment with a configurable tool that you can spend a little bit of time on and you can see quite quick results. And it is about starting small. It's not promising the world straight away, but it's starting small and tackling that one particular issue to then think, okay, well, what logically makes sense? What would logically improve it? You know, my background is product, like a product background. And I one of the most striking things I think around kind of this concept is that it's often like 80% off the shelf requirements, that's fine, but it's that 20% that it's not meeting that actually directly influences whether a clinician will use it or not. And it's that 20% that I think we're collectively talking about.
Yep. Great points. Thanks, Fiona. So we've got a bit of time to do and cover some audience questions. So if there's anything that you would like to ask, type your questions into the chat. I'll kick us off with the first one. Ian, did anything surprise you in the findings from the report? So we got feedback from lots of different organizations and different roles. Did anything surprise you on some of those pain points?
I don't think so, John. I think when a lot of my ex-colleagues and friends are 4 years into an EPR deployment, and a lot of the points that they talk about on a daily basis are consistent with the report. I think they spent a lot of time front trying to plan the EPR rollout, and they're feeling the same frustrations that other organisations are feeling. And I think that's because it's really difficult to get to all the edge cases. As Fiona said, the 20% is creating the wall of noise. That's the frustrations that build up, and it's really difficult in terms of your procurement to get that right, because it's really hard to take on board, and especially when there's an enormity of the healthcare operations especially across integrated trust, where where there's a whole variety of workflows and processes and connectivity with other organisations that it's hard to pinpoint the whole variance. And I think that's just flowing through my conversations inside the trust, and it's also representative of the report that's been produced.
Great points. Thanks, Ian. And Fiona, did anything surprise you in the findings in the report? Was there anything that was unexpected, perhaps?
No, but yes, I suppose it's what I started with, which is, I think for me, there were two things that were the most striking. The first one was this manual rekeying. Obviously we were all waiting for the 10-year plan. We knew that a big pillar of that was from analog to digital. And yet the day-to-day experience based on the feedback in the report still feels like quite a bit away from that. So, it's not surprising, but at the same time it is, given the sort of the policy ambition, I think. And the other thing I think is this, whether it be a fear or a resistance to be able to do things within the teams and the services themselves because of governance. So I think there's a really big question to ask about, in the context of some of the workforce changes across the NHS, how do you create a safe environment for people to innovate in a way that optimizes for productivity, optimizes for efficiency, and creates that sense of ownership to improve that experience, but also to create a propelling vision for how digital can improve and optimize workflows, patient flow and patient experience, and the experience of clinicians.
Great point. Thanks, Fiona. We've had a question come into the chat. Do you think the 10-year plan has given us an increased sense of urgency around tackling some of these challenges? And how can we ensure we're not having the same conversation in 10 years' time? So, interesting question. Ian, would you like to tackle that one first?
Yeah, I mean, I think there's definitely a sense of urgency around tackling the challenges. I think the lag in the system at the moment is the funding and the pressures on budgets. I know I'm talking to, again, some of my old colleagues across the area that I live in, and they're really struggling with the financial burden that they have. And I also think some of the areas where there's great practice, the shared care records have great data sharing agreements in them, and how does that flow down? How do we replicate things that are going well really, really quickly down to the places that matter, which is the interface between health and care and different provider sets? And I think, I went to a conference where Minhal, who's running the neighbourhood teams, presented, and she's talking about collaborations of the willing. And we need to find those collaborations and make sure that people that have the right perspectives and looking at things through the right lenses can activate some of the changes really quickly.
Very interesting point. Fiona, is there anything that you would like to add to that question around, do you think the 10-year plan has increased urgency around tackling some of these challenges?
Yeah, I mean, I agree with Ian. I think I suppose the 10-year plan in terms of its ambition is completely right. Like it's very reflective of the lives that we lead. And, and I mean that in every aspect of our lives, we all have digital components. So it makes complete sense. And I think the changing patient expectations compounds that as well. I think in addition to the budget pressures, we also have those workforce constraints. And particularly at the moment, every day in industry press, we hear about more of colleagues being affected. And I think it's really difficult to really have these conversations and not really give due attention to that. And I think being able to kind of have a response to that, which isn't, another procurement that's going to take X number of years to go live, and actually be at the time it does go live, will be out of date in terms of what the needs and requirements are. But thinking, what can we do at speed and at pace? And not starting with these big bang ideas and suggestions, but how do we equip people with the tools and the skills and the confidence and the safety net to be able to kind of come up with these solutions because they are experiencing these problems day to day. I think it's a way of working and it's a culture, and I think it's this idea of these digital champions that kind of creates that bit of ethos and energy across different organizations, different specialties, different services. So they can be the architects of their own sort of destiny, I suppose. Again, I'm getting very grandiose with language. I don't mean to, but it's what I mean. It's in terms of being able to drive solutions, I guess.
Yeah, absolutely. No, great points. Thank you. I think that's it for all our questions from the audience. So it'd be nice to finish with one key takeaway from the discussion today, or perhaps the report, and then I'll look to close the session. So we've only got a couple of minutes. So if you were to share one key takeaway, or if you want our audience to go away with one thing that we've discussed today, what would that be? I think that'd be a nice way to wrap up the session. Ian, do you want to take that one first? One key takeaway, please.
I think it's the one key takeaway for me is that the problems are consistent across the piece, but they're not insurmountable. This is about a shared understanding about there being people there to solve problems. That there's an industry out here who is evolving really quickly, but there's also a need to make sure that it's controlled. Patient safety is obviously the ultimate driver of these digital systems. But I think we if we come together as a community for the better of the patient good, I think we can solve most of these problems with sound governance, and we can solve them really quickly. So for me, it's great that everyone's feeling well, it's not great that everyone's feeling the same pain, but it's pain that we can solve really quickly if we can have great conversations around being able to solve some of these issues.
Great point. Thank you, Ian. Fiona, what's your one key takeaway, please?
I think the takeaway has to be to start with the workflows, not the systems themselves. So, what will actually tangibly make a difference day to day, and with that in mind, thinking about some of these areas of friction. So whether that be the manual rekeying, or whether it be that the information isn't being able to move across from system to system. So I think really understanding that workflow, really understanding the pain points that you're trying to solve, and then creating an environment for agility and being able to solve it using tools like ours. I think that it will create an energy and a culture that's going to be really important in this transition from analog to digital.
Fantastic. Great point. And that closes our session nicely. So thank you for that. Fiona, Ian, thanks for the session today. I think we've covered a lot and it's been really insightful. So it has been recorded and that will be shared as well as a write-up. But also the report that we've been talking about today, that will be shared shortly after this webinar. And if you want to connect with Fiona or Ian outside of this call, you can do so, and we'll share some contact details as well. So we'll share the report quite quickly. I think that's everything. So again, Fiona, Ian, thanks for a great session. We've covered a lot over this hour and a lot of pain points, but it's nice to finish with lots of ways to tackle those. And I think that's really valuable. So yeah, I'll close the session here. Thanks to everybody for attending. Fiona, Ian, thanks again, and have a nice day, everybody. See you on the next webinar.
Yeah.
Thank you.
Thank you.
Cheers. Bye.
Bye.